Hello, John Hively here. It's May 25th, and today we're going to take a look at the Republican budget proposal that passed the House by one vote last week, and that's due to cut Medicaid and Medicare by $500 billion and throw 3 million people off of food stamps so that the tax cuts received by billionaires and their corporations, and let's face it, it is their corporations. Corporations are owned by the wealthy for the most part, and 67 to 100% of their income and wealth is derived from corporations, from the financial markets. So the billionaires and their corporations have received billions of dollars of tax cut during Trump's first term, President Trump's first term, and now those tax cuts are due to expire, and President Trump wants them to continue permanently while giving modest temporary tax cuts to things such as Social Security and to waitresses' tips. And they're modest cuts. I mean, you're going to basically eliminate the tips, but they're only temporary cuts. So let's take a look at what people have to say about these cuts to provide tax breaks to billionaires. You know, the richest people in the whole damned history of the world, who are among the least taxed historically in the history of the United States and probably in the world too. So anyway, it's an oligarchy that we live under, and the oligarchs are calling the shots, and it's a big income redistribution scam that's going on with that bill. And as I pointed out in previous videos, right now we're all paying higher interest rates on our automobile loans, our credit card payment loans, our mortgage loans, because of just the appearance of that, just the thought of that big, beautiful bill that's going to be make permanent tax cuts for billionaires, because it's going to expand the United States budget deficit, which has gone from $9 trillion to over $36 trillion in the last 16 years. Now imagine, I believe from 1966, during the height of the Vietnam War, to 1976, shortly after the end of that war, how much did the federal deficit, that is the total amount of debt, how much did that increase in that 10 years? And the answer was about 1/3. It went from like $400 billion approximately to about $600 billion. So here we're now, 50 years later, and it's gone from 9 trillion to more than 36 trillion. So 300 to 400% higher. That's huge. And there's not even a real war we're engaged in, although we're engaged in a bunch of wars. So anyway, the result of all this controversy with the budget deficits, with Medicare cuts, with food stamp cuts, etc., the result has resulted in a civil war within the Republican Party between MAGA supporters, such as Missouri Senator Josh Hawley and President Trump's former advisor, Steve Bannon, and what Hawley calls Wall Street Republicans. Anyway, let's take a look first at what Hawley has to say. So this is an interview with Missouri Senator Josh Hawley about 9 days ago, when the Republican budget busting federal budget bill, which is going to increase the federal deficit by 3 to 4 million, 5 million, $1 billion, $1 trillion. Actually, it's $1 trillion. It's when it was before it passed the House. Anyway, this is Josh Hawley.
State where roughly 1 in 5 people are on Medicaid. He wrote a New York Times op-ed this week with a very simple message: don't cut Medicaid. Senator Hawley joins me live now from Capitol Hill. Senator Hawley, thank you so much for being with me this afternoon. So as we just showed you, you were warning your party not to cut Medicaid. The speaker, though, he just said this about the House GOP's so-called big, beautiful bill. Listen.
Would you cut Medicaid? We're not cutting Medicaid. Stop buying that.
So they're not cutting Medicaid. Now, technically, they're not, but they're increasing things like co-pays and other costs to the people who need Medicare, to the poor. They're increasing the cost of Medicaid, which will likely throw them off. And they're also increasing work requirements. Well, about 65% of of Medicaid recipients already work. And they just, I'll go into this a little bit about how just the work requirements alone are going to throw people off via red tape. The New York Times reported on this just yesterday. But for now, let's continue with Josh Hawley.
You were warning your party not to cut Medicaid. The speaker, though, he just said this about the House GOP's so-called big, beautiful bill. Listen.
Will you cut Medicaid? We're not cutting Medicaid. Stop buying that.
So he said, if you heard there, Senator Hawley said, we are not cutting Medicaid. Do you agree with the speaker? Is this bill not a cut to Medicaid?
Well, the right thing to do is not to cut Medicaid, so I'm glad to hear him say that. Manu, it ought to be just a basic foundational principle. It is wrong to cut health care for the working poor. That's what we're talking about here with Medicaid. My state is a Medicaid expansion state. Over 20% of Missourians, including hundreds of thousands of children, are on Medicaid. And Manu, they're not on Medicaid because they want to be. They're on Medicaid because they cannot afford health insurance in the private market. These are working people and their children who need health care. And it's just wrong to go and cut their health care when they're trying to make ends meet, trying to help their kids, trying to make sure that they're able to provide for their families. So I hope that the House GOP and the Senate GOP will get the message here. By the way, President Trump has said the same thing. No Medicaid benefit cuts.
So, Senator Hawley, the expectation, though, is in this House GOP plan, millions could lose health insurance coverage. We're waiting for the exact numbers when the Congressional Budget Office analyzes this impact, but that is the expectation. And also, some of the changes could put some rural hospitals.
Since this interview with Hawley 9 days ago, the Congressional Budget Office has come out and said, with their analysis, that 7.6 million Medicaid recipients are going to be thrown off Medicaid, and another 3 million people are going to lose food stamps. You know, so you're talking about millions of children losing their health care, and millions of people, including children, losing their food stamps. Anyway, let's go on.
Hospitals at risk. It also puts in place some new copay requirements for Medicaid beneficiaries. Does that concern you?
Yes, both of those things concern me. Number one, I don't want to see any more rural hospitals in Missouri or anywhere else in America go out of business. We've lost too many of them in the state of Missouri, Manu. I don't like the idea of decreasing funding for rural hospitals. I'm worried that the House bill goes way too far in that regard. I also don't like what is basically a hidden tax on working poor people who are trying to get health care. I mean, this whole idea of we're going to charge them now additional copays in order to access health care, I have to say that just sounds like a tax to me. So now we're taxing poor people when they're trying to get access to health care? I've got big concerns about that.
So what that means is they are taxing the Republican Party. The Wall Street Republicans intend to tax poor people in order to pay for to make permanent the tax cuts for billionaires and their corporations. That's what they're doing. It's a big income redistribution scam, especially when you consider you're now paying higher interest on your mortgages, car payments, credit card payments, etc., to provide the billionaires with their tax cut. Anyway, here we go.
So if this bill comes over from the House to the Senate and you have to vote on it, are you no if this bill does not change?
I'm not going to support this bill from the House in this form. I think that's clear. It's got to change before it can pass the Senate. And I continue to stand by my line in the sand, which is no Medicaid benefit cuts. Listen, if you want to do work requirements, I'm all for that. I bet every Republican and I bet most Americans would agree with that. But we're not talking here about just work requirements. The House goes much, much, much further than that. This is real Medicaid benefit cuts. I can't support that. No Republican should support that. We're the party of the working class, Manu. We need to act like it.
Yeah, speaking of that, in your New York Times op-ed that we just showed, you wrote this about some of your GOP colleagues. You said, quote, "This wing of the party wants Republicans to build our big, beautiful bill around slashing health insurance for the working poor. Republicans need to open their eyes. Our voters support social insurance programs. More than that, our voters depend on these programs. You also point out that President Trump increased GOP support with the working class. So do you think your GOP colleagues in Congress are too focused on making life easier for corporate America and frankly wealthier Americans than the working class?
Well, I would just say it's a mistake to listen to outlets like the Wall Street Journal, for instance, that never met a corporate tax cut they didn't love, never met a corporate goodie that they didn't absolutely relish, but want to tax the working class like crazy. It's reverse class warfare is what it is.
No, it is class warfare, and that class warfare the rich have been waging since the mid-1970s. And that's why the rich have been able to take, according to a Rand Corporation study, $65 trillion from the lower 90%, the lowest earning 90% people, and put it into the hands of the billionaires and the trillionaires. Okay, there are no trillionaires, but the billionaires, definitely. One of those guys is soon to be a trillionaire, I'm sure. Anyway, here we go.
Taxing the poor to give to the rich. And I'm totally opposed to that. Republicans now, thanks to Donald Trump, are the party of the working class, Mono. You referenced the returns from the last election. The big majority of working class voters voted for the GOP. That means now the GOP needs to deliver for them. And we do that by giving them tax relief. We do that by bringing down their health care bills. We don't do it by cutting Medicaid.
If this bill becomes law, are you concerned that Republicans could face a severe blowback in the elections next year?
No, this bill is not going to become law in its current form, not least because President Trump won't sign it. Mono, I've talked to him about this personally multiple times. He has been crystal clear in public, too. No Medicaid benefit cuts. We need to give a tax cut to working people, not raise their taxes when it comes to health care, not take away their health care benefits. I hope this bill will get refocused on delivering relief for working families. That's what we ought to be doing.
Do you think some of the wealthier taxpayers should pay higher taxes?
I'm fine with that. You know, the president has floated that. He said maybe we ought to allow the top rate, to the very top rate for people making over $1 million or over $5 million a year to go back to where it was before. It's like a 1-point increase, Manu. I would be fine with that if that's what the president wants to do. Bottom line is the focus ought to be working people. Working families were hammered under Joe Biden's presidency. Let's be honest. They cannot afford their groceries. They cannot afford their rent. They can't afford to buy a car. We need to give them tax relief. We don't need to take away their health care.
This is a New York Times report dated May 23rd. So this isn't really a report. It's more of an editorial. But the evidence suggests, what they say, the evidence suggests that work requirements don't work. Federal law already allows states to impose Medicaid work requirements in some situations, and Arkansas briefly did during the first Trump administration. Subsequent studies found no resulting increase in workforce participation. Most of those subject to the work requirements already were working. Like 65% of recipients of Medicaid are already working. Most of those subjects to the work requirements already were working, and the termination of benefits did not address the reasons the remainder were not. The primary effect of the Arkansas program was to strip Medicaid from people who were eligible. And let's hang on a second here. Basically, the Times points out that you can deprive people of Medicaid with paperwork. So they write here, the problems extend beyond paperwork. A work requirement can deprive people of health insurance if they lose work through no fault of their own, or if they are unable to obtain enough work. The loss of health care can then make it harder for them to find a new job. So, and then they provide an excellent example. So the example here is Luke Seaborn is a case study. He is a 54-year-old auto mechanic in Georgia, another state that introduced a Medicaid work requirement, and he initially obtained insurance through the program. Over the past year, he has worked steadily, but he lost his insurance twice because of paperwork problems, according to ProPublica. And they quote Luke Seaborn here. I did what I was supposed to do, but that wasn't good enough, he said. So there you have it. The work requirements are going to probably kick some people off of Medicaid, but not to the tune of 7.6 million people. But because of higher costs, higher co-pays, etc., that people cannot afford anyway because they get paid so little, since $65 trillion has been taken from the lower 90% of citizens and redistributed by the wealthy into the pockets of the billionaires. Anyway, that's a nice sunny day, and I'm out of here. And you guys have a good one, and we'll talk to you later. Bye. Oh, if you like this, what the information provided here, please like, subscribe, or share, I'd appreciate it. I have a battle plan, as you know, that I'm building the foundations for. And I think we can do something to change the United States from a fascist oligarchy, which it is right now. And we'll go into why it's a fascist state in another video. And we can change it back into a democracy, which it hasn't been since probably the 1970s. And certainly it was in transition, so there were some democratic aspects to it in the 1980s, by the mid-1980s. But then it was completely toast by 1994 as far as a democracy. It hasn't existed, democracy hasn't existed in the United States in a long, long time. Have a good one. Bye.